Ready.
Okay. Well, good afternoon, everyone, and thank you for joining us for the NIFA Veterinary Shortage Situation Nomination webinar. We're taking a slightly different approach this year, so hopefully this will bring you a lot of good information, and we welcome your participation in the question and answer session. So if we go to the next slide, just briefly, in accordance with federal civil rights law and U.S. Department of Agriculture and Civil Rights regulations and policies, the USDA, its agencies, offices, employees, and institutions participating in or administrating USDA programs are prohibited from discriminating based on race, color, national origin, religion, sex, gender, identity, including gender expression, sexual orientation, disability, age, marital status, family parental status, income derived from a public assistance program, political beliefs, or reprisal or retaliation for prior civil rights activity in any program or activity conducted or funded by USDA. Remedies and compliant filing deadlines vary by program or incident. This slide contains contact information for individuals with disabilities to request reasonable accommodations to participate in or apply to our programs. This includes language access service for limited English proficient individuals upon request. And anyone wishing to file a complaint can utilize phone number, fax number, or postal mailing address listed on the slide. And this includes needed to participate in the filing of your shortage nomination. So if you require any accommodations, you can let us know, or you can use the contact information on this slide. If you go to the next slide. Just a brief overview of what we'll be covering today. I will briefly introduce the NIFA staff. I'm going to give you some updates for FY2023, and then look at some considerations for when preparing your nominations. Then we've invited a panel of 3 state animal health officials to talk to you about some of their lessons learned, and then we'll have an open question and answer session. If we go to the next slide. Just briefly, I am Michelle Colby. I'm a veterinarian and a national program leader working with VMLRP and the VSGP. And Bob Smith and Kathy Bjork are 2 other veterinarians and national program leaders who work with both VMLRP and the VSGP. Marlene Azevedo, who many of you are familiar with, is the program coordinator for the VMLRP. Danielle Farley is the program specialist who supports both the VMLRP and VSGP program. Derek Alexander is a AAAS fellow who's working with us on these programs. And Meredith Berry is a program assistant that supports both programs. So I'd like to thank the entire team for their contributions to the program that we're presenting today. We go to the next slide. Just some updates for fiscal year 2023. The open nomination period, as many of you are probably aware from the Federal Register notice, is October 4th through November 14th. We will have optional office hours during the open nomination period, and Danielle will be sending out a Zoom at some point in the near future. They'll be every Thursday from 3 to 4 p.m. Eastern Time from October 13th through November 3rd. Many of the NIFA staff will be at USAHA. We do plan to attend most of the regional meetings, so we look forward to seeing you there. But we're also open to meeting with you separately if that's an option, so feel free to reach out to us. We have a new process for joint state nominations, which we will talk about in our online webinars that are coming up soon. And that will include an overview of the shortage situations and an overview of the veterinary shortage nomination form. So rather than covering those things in this webinar in a very static format, we're just recording those and we'll post those in the near future, and they'll be included in one of the emails that I'll talk about on a later slide. And an updated state animal health official guide, which will also be coming out in a future email. We go to the next slide. I have a few slides that just talk to some consideration when you do start preparing your nominations. So one thing we would like people to consider is making sure that when you describe the activities you're describing specific activities that correspond to the must-serve species listed. For example, if swine is listed as a must-serve species, make sure you describe the nature of the industry to be served. For example, commercial versus backyard swine, and any specific clinical activities that are needed to adequately address the shortage. And this will allow applicants to better understand what's expected of them, and the review panel to better evaluate an applicant's fit for the shortage. Also consider carefully which are the most critical must-serve species in each shortage area, so that those with relevant skills will feel that the application is an option versus an insurmountable hurdle for them, and that the panel won't feel that every candidate is underqualified because they haven't demonstrated all the expertise with every species in their application. Selecting the most critical species allows applicants to better showcase their skills, education, and experience for serving the most critical species in that area. Keep in mind that at least 50% of the awardees, of an awardee's percent FTE can go towards the must-serve species. Do include outreach activities that you would like an awardee to be involved in, such as producer group meetings, 4-H, communications with producers and producer organizations. So the awardee can think about what kind of meetings, presentations, publications, brochures, newsletters, blogs, what variety of activities they might consider. Do also consider the seasonality and flow times with specific species, and list activities an awardee can do during these times. We go to the next slide. Do consider using all the allocations your state has for nominations. This could allow you to nominate smaller geographic areas, more type 3 positions, or also consider working with a neighboring state to nominate joint state areas. Also, try to avoid using specific language such as new veterinarian, young veterinarian, or new graduate. The MLRP is open to all who meet eligible student loan debt of $15,000, and VSGP is open to food animal clinics serving the shortage area. Feel free to be explicit in your nomination about whether the purpose of the nomination is recruitment, expanding the number of food animal veterinarians in a particular area, retention, maintaining the current number of food animal veterinarians in a particular area, or both. And do consider including species such as honeybees and aquaculture or fisheries as must or may serve species if they're relevant to a particular shortage area. We go to the next slide. A few other considerations. Do write clearly on the consequences of not addressing a veterinary shortage situation as it pertains to a safe food supply and the health of animals, humans, and the environment if a veterinarian is not secured or retained. Include how long the position has remained unfilled, percentage of turnover in the area, outreach advertisement efforts within the area, disease outbreaks, detriment of service, livestock, community, national and international implications of not having the service filled, etc. Do distinguish recruitment versus retention for the purpose of each nomination. Recruitment is focused on efforts to expand the number of food animal veterinarians in a particular area. Retention is focused on maintaining the current number of food animal veterinarians in a particular area. For type 3, please be sure to discuss what other recruitment and retention tools were or are available, and have those already been utilized, exhausted, and if not, why is the VMLRP needed at this time? Also carefully consider the geography when defining a shortage area and percentage full-time equivalent. Please remember that these are not just utilized by applicants, but by the peer review panel. Not everyone is familiar with your state. If a shortage includes a large number of counties, consider adding a short description of why these were grouped together, how this is manageable, or if partial coverage of the number of counties is acceptable. Review the needed area to determine what is feasible to drive for services, as well as allowing for the awardee to be successful in attaining the designated percentage full-time equivalent. So before we move on to the panel portion, I just want to see if there are any questions that we need to address, and also if Bob, Kathy, or any of the rest of the VMLRP team had anything to add to this.
The one thing I would like to add, if you don't mind, Michelle, is with regard to the may serve and must serve species. So the must serve, you probably want to keep it down to 2 or 3 species, you know, especially if they're combination of ruminants and non-ruminants. It's usually hard to find a match for an individual with those kind of skills. But on the may serve, you know, may serve is anything that they may see in that while providing veterinary services to your area, even if it's only one time they see that species in a given quarter. So that's why we suggest you add anything, any animal such as an equine, even though it might not be significant in your area. If they happen to go by a farm, they need services, they get credit for that services when they fill out their forms or logs for us to examine, okay? If you don't fill in that may serve, they will not get credit for looking at that species. So it wouldn't be unusual to put quite a number of species in the may serve. The applicants really don't have to address those may serve species as significantly as the must serve species. So I just wanted to emphasize that to everybody here. Thank you.
All right, thanks, Bob. All right, not seeing any hands or any questions in the chat box. I'm going to move on to the panel portion. So if we go to the next slide, I just want to briefly introduce our panelists, then I'll review the questions that they're going to speak to, and then I will turn it over to the panelists. So we have Dr. Justin Smith from Kansas State Department of Agriculture, Division of Animal Health, Dr. Scott Libesley from Idaho State Department of Agriculture, and Dr. Angela Lackey from Texas Animal Health Commission, all joining us today to speak to the following questions. And so we've asked them to talk about what the process their state uses to identify veterinary shortages, who's involved in the veterinary shortage identification nomination process in their state, but both staff and stakeholders, and how do they raise awareness regarding funding opportunities, both VMLRP and VSGP within the veterinary community within their state to encourage applicants. So Dr. Smith, we will turn it over to you.
Before Dr. Smith starts, I just wanted to invite anyone who was interested in sharing their perspective in the chat. We'd love to hear from other folks too. So Marlene has posted the questions in the chat. And if there's something specific or unique that you'd like to share about your state, please feel free to do so. And with that, I hand it over to Dr. Smith.
Okay. Well, good afternoon, everybody. And thank you to staff for the invitation and the opportunity to talk a little bit about our VMLRP program here in the state of Kansas. So, I mean, I would be remiss if I didn't say that this is kind of an effort via a task force that we've identified. So we have some folks in our state that are very passionate about this cause and have made it really part of their job process to be involved in this task force and to help us identify shortage areas as well as identify candidates. And so we do have a task force that's made up of veterinarians. There's a couple USDA personnel on that task force as well for guidance. We have some community folks, as well as we've had some past VMLRP recipients on this task force. So when we identify our shortage areas, the first thing I would say is it isn't just a seasonal thing. These folks that are out in the communities that are involved in this conversation are all the time, visiting with different folks as far as what is the needs and practitioners that are looking for folks to bring on board, or practitioners that have a job and are looking for some relief. And so it's a conversation that we continually have out there through meetings, through just veterinary visits, as well as with our local economic development groups, our communities, and that type of thing. So it's not a seasonal thing. It's something we do all the time. This task force does all the heavy lifting as far as identifying these areas. One of the things that we have learned through experience is that we feel like if for a nomination area to really get some significance with us is there has to be somebody in there that has a need. We haven't found the tool to be very useful for a veterinary clinic as a recruiting tool. It's a phenomenal retention tool in their respect if they can get an applicant that qualifies. So we're really trying to identify some of those applicants that are available and then try to develop a shortage area around those applicants based on the work they do, the species that are there, as well as with the population density and those counties. So we try to build a nomination area around those applicants that are already in place and hopefully use it as a retention tool. So again, as far as who's involved in that identity or that veterinary shortage identification nomination process is I probably covered that in the first part. We try to make it holistic. We try to have that conversation with a lot of different people. The university, we have conversations with the veterinary students that are there and look into where they might be going. And if they've got a job offer already, you know, can we build something that would help them out in that respect? And so we try to make it that. We try to make everybody involved in it. Like I said, our task force is made up of about 8 people. From various aspects. And so we feel like we cover a pretty broad spectrum across the state as far as where those nominations and where those shortage areas might be identified. We also visit with our stakeholder groups, you know, our livestock associations, as well as from the dairy world, from the livestock world. I know I'm repeating myself, but it really is. It's conversations that we have all the time out there in any kind of a presentation or any kind of a public outreach that we might do. As far as raising awareness to that funding opportunity, we do through our office, we have occasional what we call flash reports that we push out information to our accredited veterinarian. So we will occasionally push out, particularly this time of year, 1 to 2 to 3 times, we'll push out a flash report just as a reminder, more of a reminder to get a hold of us and let's visit about it. But we also have the opportunity to visit with all of the senior students through the beef rotation, through the equine rotation, and this is part of that conversation. We visit on a lot of different accreditation issues, but this is a big part of that conversation about making them realize that this opportunity is out there. Whenever we do our discussions with our Veterinary Medical Association, this is part of the conversation that we have out there. And then likewise, like I said, we really work a one-on-one basis trying to make those folks identify. The leader of our task force has got a great pulse as far as having a conversation and having a resource group that helps feed some of these folks back to us. And we're not afraid to make a one-on-one call and try to provide some more guidance to those folks in an effort to try to, one, make them an applicable applicant, but also help them through the process. We have some folks that have been on the review boards before. They've got some great insight. So we'll really try to guide them and try to direct them to help some of that success out there, as well as we try to encourage veterinary clinics that if they can help us develop that nomination shortage by what can that community provide, not just to the veterinarian, but what can it provide to their family, to their support folks as well. That helps us build that nomination and basically flesh it out to where we've seen far better success when we've done that process. We've done this for the last probably 6 to 7 years, and we've obviously seen our process mature, and we've been more successful. We've seen success from it, and so right at this point in time, I don't see that we'll change our approach to it other than just try to continue to enhance it. So with that, I hope I addressed the 3 questions appropriately. If there's more that I can add, please feel free to let me know.
You did. Thank you very much, Dr. Smith. Dr. Livesley?
Yes, thank you. Good afternoon. So I'm Scott Livesley. I'm the state veterinarian of Idaho, and the process that Idaho has used traditionally in the past to identify the areas of veterinary shortage has mostly been relied upon with personal interaction with either veterinarians or livestock producers. And a couple of years ago, we decided we needed to try and find some other sources of information to identify that. One that we have just put in the request for. So we're the Department of Agriculture. Idaho veterinarians are regulated through the Board of Veterinary Medicine, which is Division of Professional Licensing. So it's a completely separate entity. And we approach the Board of Veterinary Medicine for when announcements and letters go out to renew your veterinary license on an annual basis, if they could start putting questions in there so veterinarians could report what their practice demographics are. I know all of us have been through, many of us have seen veterinarians start out as large animal and they slowly transition away to mix and maybe eventually small. And so finding out exactly, what veterinarians report on an annual basis, what their practice demographics are, I think will be extremely helpful. One other thing to note that Idaho actually does not have a veterinary school. We have a contract for 10 seats at Washington State University in Pullman, but that's all. And so we unfortunately don't have a home population of veterinarians that will go to vet school and potentially come back home to practice, just those 10 seats. And we don't prioritize. There is no admission priority for large animal practitioners for those 10 contracted seats. So we're working on those, but what hopefully we'll see is if the Board of Veterinary Medicine can just add a few demographics questions each year when license renewals come up, I think that'll help see how the existing veterinary population evolves over the course of their career. We're still relying heavily on personal interaction with veterinarians, and then feedback from industry groups. And so our primary industry groups are the Idaho Dairymen's Association, the Idaho Cattle Association, and the Idaho Wool Growers. I put out an email announcement in the fall, and I do email all of Idaho's category 2 accredited vets. That's about anywhere between 200 and 300 names that I send emails out to, and I maybe get a dozen responses, but I do ask a lot of the points that Bob made earlier. Is I ask those specific questions, give me some specific information why your area is short. And coincidentally, I got an email last week is unfortunately one of our large animal practitioners just a week ago passed away in Eastern Idaho. And so we had people say, do you know how we can get his veterinary practice sold, and what can we do to try and help the clients that he left behind find coverage, because Eastern Idaho is one of the areas where we very badly suffer from production animal service insufficiency. So I rely very heavily on the personal interaction there. And then in the fall, when the industry groups are having their annual meetings, I do usually request time to give a presentation to each of them and ask for, solicit data from them. Like, how are you guys' abilities to schedule vets? Are you having to schedule them very far in advance? And questions like that. Who's involved in the vet shortage identification? So once I get all that data, I'll confer with my director of the Department of Ag. The Idaho Veterinary Medical Association has a pretty diverse, their board is fairly diverse. We've got small, mixed, and large animal practitioners. So I'll discuss it with them. I have an appointed seat on the veterinary medical board, on the Idaho Veterinary Medical Association board. And so we'll discuss the issue when it comes up in our fall meeting to see if they have any suggestions or any different approaches that they can offer to put in our shortage nominations. And then we've had a long-standing task force. It wasn't specifically related to veterinary shortages. We have a trick task force. And so we meet usually once a year. We review, how the subject and the issue of trick diagnostics, as well as any positives we've identified. But I've been actually kind of using it as an ad hoc group to address the veterinary shortage issue with. And so that's comprised of professors, industry members, as well as large animal practitioners. And so I've used that just this past year. We have started making presentations to the legislature to let them know that this is a problem. And since we don't have a veterinary school, we've tasked them with trying to come up with a way to recruit, not necessarily through NIFA's program. They're aware of it, but our shortage is getting to the point where if we don't start addressing it in a separate state-based approach, then we may be in real trouble before too long. But once it comes down to the director of the agency, of my agency, and I will sit down after we've had all that information, and then we'll use that and compile it and identify which shortage areas we're going to nominate for the next year. And then raising awareness, as I've said, a lot of what Dr. Smith has already mentioned. Speaking to the industry, we'll announce when the grant programs, the VSGP announcements are made. I set out an announcement congratulating the practices that got it. I was very happy. Idaho was lucky to receive 2 shortage veterinary service grants this year, which is great. And I'm glad to see that the veterinarians are using that. I think historically that program has got a little bit less press and had a little bit less awareness than the VMLRP did. So I've been trying to push that through personal interaction and emails that I've sent out to Idaho's veterinary practitioners. And lastly, again, we go to the legislature. We've been making presentations and then speaking again to the industry groups. So our biggest problem is, we have populated areas in Idaho. This lends itself to the geography question that came up earlier, and we have very, very sparsely populated areas. And so, it's not just veterinary services that are not available. It's typical any type of service, whether it be broadband internet or emergency service or fire departments or whatever. But those are challenges we've had existing programs throughout the state, and we're trying to ask the legislature for a little bit of help as well. So I'm happy to take for any questions, but that's pretty much how we've done it so far in Idaho.
Thank you, Dr. Livesey. I do not see any questions in the chat box at this point in time, so we will move on to Dr. Lackey.
Thank you, Dr. Colby. Good afternoon, everyone. Just a few additional comments of some things we're doing here in Texas. Our shortage areas are generally being identified by 3 different sources. And so first, we reach out to any inquiries that we've had over the past year. I've got kind of an ongoing list of people that might have reached out, and maybe they heard about it after the applications already took place, or for some reason their timing is just off. So I'm keeping a list of those folks, and we'll be reaching out to them here shortly to give them personal notification and information about that nomination process. Secondly, we, like everyone else, do our best to try to message out, and that's always sometimes difficult because veterinarians are really busy people. So we use a variety of methods. We let our livestock and veterinary industry groups know about it because they can help make those notifications as well. Other government agencies, but we're doing that through a variety of methods and directly to accredited veterinarians. So we'll do, they might be email blasts through Constant Contact. We're active on social media platforms. So our communications team is putting some things out there like that. We've got the opportunity to do some written articles for our TVMA monthly magazine that goes out. We've got a quarterly accredited veterinarian newsletter that goes out, and of course we can feature it on our website and so on and so forth. And then, the last means of reaching out and trying to identify new shortage areas would be just reaching back to some of the previous nominators for shortage areas. We generally, it's typically an accredited veterinarian that will kind of nominate their area for a shortage area, and we'll begin to write up that application process or that application. And so we'll reach back out to some of the previous ones and just ask how things are going. We'll make note if if they received any applications in those particular shortage areas, and just visit with them and see if there's a reason to continue to keep that particular one on our list. And then we have our nominations turned into us about a month before they're due to the USDA. And that allows for us internally to kind of compile all of our different shortage area applications or nominations that have come in. And then we can move on to our process. So that second question of who's involved with this process in our state, we don't have an official name for the team, but we've got a group of people, primarily volunteers, that will drop on or join us from year to year. So right now we've got folks on there that are part of our livestock industries, also our veterinary industry groups, university and diagnostic lab representatives. And so we added a new one this past year because we've got a second veterinary school in Texas now as well. So we make sure that we've got representation from both of those schools, which is really important. Several other people from our agency, Dr. Schwartz, of course, and some of our regional directors as they have interest and passion in this. We add those folks. And then we've got some accredited veterinarians on that group as well. One of which I know has been involved in reviewing the applications. So he was a really good resource of, some of the questions that we might have had or ways to make our applications more effective. So we appreciate you sharing those pointers earlier today as well, because those are always very welcomed. So with all of the nominations that we receive in, we put together kind of a spreadsheet just with some basic information that people on our team would want to know. And we do an informal attempt to try to rank those because often we would have more applications than we actually have allotments to turn into the USDA team. So we have to have kind of a process of narrowing those down to the number that we would actually submit to the USDA. So just a brief ranking there. And it varies from year to year. I would also agree with the comment that Dr. Smith has made that we have seen this isn't maybe the best way to recruit people. And we've tried that in the past and it hasn't been largely successful, but certainly does help with retention. It's not a guarantee for retention by any means, because people have gotten creative in this job market and, have come up with other ways to recruit that might be more important to people than something along these lines. Then finally, I think I kind of already covered, how we raise awareness. So it's always good, I think, to have discussions like this so we can come up with some new ideas. So really appreciate Idaho sharing their ideas on surveying and doing some things like that. I think those are great ideas. But I think that covers it for Texas. So I'll turn it back over to you, Dr. Colby.
Thank you so much, Dr. Lackey. I would really like to thank all of our panelists today. I think this was a really helpful discussion. And as Marlene just added to the chat, if anybody else has anything else to contribute in terms of your own unique techniques, resources, or stakeholders that your state utilizes for this nominating of veterinary shortage situations, please feel free to contribute to the chat. But at this point in time, we're open for questions. Yes, Andy, Dr. Schwartz, we'll get to your question in a minute. We do have we do have a timeline, and we'll talk about, Dr. Schwartz asked about receiving word on awards for the current set of applications. Actually, Danielle, if you want to go to that slide, maybe we'll do the timeline and then we'll get to questions. So we'll give people a chance to think about questions a little bit. But just a couple of notes on key dates. So We will have an announcement that we'll send out next Monday, September 19th, on VSGP award information. September 30th is our anticipated release of the 2022 data to all the state animal health officials that will include the number of applications and awards within each shortage area. Maybe we'll get it earlier, but right now our target from our awards management division is September 30th. Ideally, it will be that date and no later. And then we talked earlier about the period for the nominations. So nominations are due November 14th. Those nominations are emailed to vmlrp.applications@usda.gov. Please do email us at that email if your state has chosen or is choosing not to participate in the program. So we have documentation of your decision. December 8th through the 14th, NIFA staff will communicate any edits needed before publishing. And those final edits will be due on December 20th. And we will get everything up and published in the January, February timeframe. So we'll be working with our web team to get everything up. All right, I think that's, and then our general information, if anyone has any questions, as always, feel free to reach out to us at vmlrp.applications@usda.gov or go to the nomination guide page. And as I mentioned earlier, we are working on updating that and we'll have it posted shortly. And what I anticipate is when we send out that email on September 30th, we'll provide links to the webinars, the updated SAHO nomination guide, and everything else, and that'll all be included in one email. So it'll all be in one place and you can find it all. You only have one email to search through since I know we all have really busy email inboxes. Bob, there is a question in the chat box about applications for VSGP do they have to come from a specific shortage nomination area?
The answer is yes. So it'd be only category 1s and 2s. VSGP cannot apply for category 3s. And yes, they will be looking at a specific shortage area to serve.
And is that for both the RPE and the EET or just the RPE?
Just the RPE. EETs don't have to worry about submitting to a specific shortage area. They're typically covering either a statewide issue or even a national issue to better prepare individuals to serve in those shortage areas.
Okay, thanks, Bob. So we have another question. When seeking service for youth agriculture groups 4-H FFA, can we list them as must serve, may serve species, or do we have to individually identify the species within the club chapter we are hoping they will serve? Marissa, can you clarify if your question is related to the VMLRP nomination form or VSGP?
It would be for VMLRP.
Okay, so if you, generally what we do is if you want them to work with the agriculture groups, there are some, on page 2, there's descriptive, those descriptive boxes, and you can put in there that you want them to work with the 4-H agriculture groups. And so you can just add it to the narrative, and then you can keep the must serve, may serve species for where they're actually going to be practicing. Does that make sense?
Yeah, that makes sense. Is that taken into account when they account for their time? Like, will they be checking to make sure they are working with youth agriculture?
If you have it listed, okay, I'm sorry, go ahead, Michelle.
If you have it listed either as must serve, may serve, or in one of those descriptive boxes, then the panel looks for it when they're reviewing the application. So they need to speak to it in their application, and they can get credit for it when they're counting in their service log. If it's something that you absolutely want them to do, then Bob, I think then she should specifically put it under other for must serve. Would that be accurate?
No, here, so must serve, may serve are species. They're animals, okay? So I want you to really devote that. We've had this conversation before. For example, if someone wants this candidate to be able to serve in sale barns or something of that nature, that needs to be in the second paragraph on the second page there, where you're talking about the services that you want these people to provide. This is where you can say, it's okay, we'd like to see you support the local fair. We'd like you to support FFA, 4-H. We'd like you to support the local sale barn. This is where, if we're trying to interpret the log, and it's not there or the must serve or may serve species, but it's an event, we will go to that second paragraph and say, well, what did the SAHOs say? What are they looking for this person to be able to provide services for? So. Does that answer your question?
Bob, I just want to clarify with you, because you said they can put "we'd like you to," and if they want to put more emphasis on it, they can actually write the language accordingly to say it's important that they serve X, Y, and Z, right?
You can say must serve or may serve. We get into those kind of words in the government, but as long as it's in that second paragraph, we're not going to try to hold their feet to the fire. If you have a must serve and they're not doing it, and you catch wind because you don't see their logs, and you find out through the grapevine they're not providing that must serve service, then I think you may want to reach out to them specifically and have a dialogue with them. But we just want to see that it's listed in that paragraph, and try not to interpret whether it's a may or must serve event that they need to work with.
But the panel will use that language to evaluate the application accordingly. So it should say how they want them to perform the service.
Well, yeah, we've had that situation where the panel does come in there, depending on how they look at it. They'd like a little bit more guidance in the nomination form from the SAHOs as far as how to interpret those nominations. Is it a must serve or may serve? But I'm trying really to be more broad and not get right down to the weeds and start picking words apart. So I'll just sort of leave it the way I've left it. So.
All right, thanks, Bob. The next question is just a question about discussing the current tax implications for award recipients, both grant and VMLRP. Marlene, do you want to discuss the tax implications for VMLRP?
Yes. So 39% of the total award that is offered to the awardee will be allocated towards taxes within their state or federal level that they are required to pay. We include that in the portion of the total award. So if they received a full awarded amount of $75,000 for the 3-year contract agreement, 39% of that $75,000 is $29,250. So then the total award offered to them will be $104,250 on that. $104,250 will be allocated to that. So it will include the loan payments in addition to their tax payment. And then I will go to Bob for the VSGP.
Yeah. And if I could just add with Marlene's statement. So please appreciate that AVMA is doing everything they can to work through Congress. We can't tell them how to do that and how they're going to do it, but we know that they're working with what they call the Enhancement Act. You probably heard about that, where they're trying to convince Congress to have a waiver of that money. So that money, instead of us spending a third of our money to help recipients pay back a loan, they can actually use that money to actually support applicants. Okay, so I think that's what it's so important. Unfortunately, that Enhancement Act does not include VSGP. Any grant that USDA gives out is taxable. Your land grant institutions, they have usually special dispensation or whatever waivers for, they don't have to worry about the tax. But when you have a a mom and pop operation, you have practitioners that are out there, yes, those are taxable. But if you got a pretty smart accountant, they're actually going to be able to write off all these things that they buy with that money, that $125,000 award for the VSGP. They're going to buy a truck, they're going to buy ultrasound, they're going to buy equipment. They can even pay themselves a salary if they wanted to, or a new hire a salary. Under those cases where they pay themselves a salary, that portion could certainly be looked at as taxable income. However, the award in general, when you're buying equipment, trucks, chutes, ultrasound equipment, all the things I've listed before, those are just write-offs, and there really shouldn't be any tax consequence to the recipients of those awards. Does that answer the question?
We got an affirmative in the chat box, Bob. Thank you.
I see that. I see that from Haley. Yeah, thank you.
Danielle, did you have something to add?
Yeah, I just wanted to add to the VSGP tax question. You know, we inform applicants and awardees of the tax implication, but we do not offer, NIFA does not offer guidance on, you know, the creative ways that Bob mentioned, and having a good accountant that is between, you know, the awarded recipient clinic and their individual accountant.
Yeah. It'd be nice if there was some mechanism for the states, and I don't know if the SAHOs have any influence on this, but if they somehow could figure out a mechanism to talk to their states on tax waivers or relief from practitioners that get those kind of awards, so that they don't have to worry about paying state taxes on them, at least. So that would really be very helpful.
All right. Are there any other questions? Danielle, you put your hand up again. Other question? Do you have a question?
Not a question, just a statement. I just wanted to let everyone know that these optional office hours that we're going to host every Thursday afternoon during the nomination period, and just as they sound, they're optional, but it's a place for you to pop in, ask a quick question about, if you have a quick question, and if those times don't work for you and your team, we're always happy to figure out a time that does. So please feel free to reach out, and also we hope to make some time to connect with you all one-on-one or within groups at USAHA. We look forward to seeing you all there.
Great, thanks, Danielle.
If anybody on this call ever wants to, maybe they don't want to speak up now for whatever reason, they don't have time, they don't have a question, but my phone's always open, my email's always open. Give us a call. You know, sometimes I get them late at night, I get them on the weekends, but I really want to make sure that we're there to support you, that answer any questions that you might have, and to make you successful in trying to fill these voids that we clearly recognize that you have within your states. So I recognize that you guys nominate about 230 nominations a year, and we're lucky if we can fill 40% of those shortages. So we need to make a lot more headway on trying to fill more of these positions. We're doing our best. It is a partnership with you, and we certainly appreciate working with you, and anything we can do to make you successful, we'll be happy to work with you on.
Absolutely. Well, I really want to thank Dr. Smith, Dr. Livesley, Dr. Lackey for joining us today. I think that their contributions to this webinar made it stronger. And I want to thank you all for joining us today. If there aren't any further questions, I'm going to also thank the VMLRP team for their contributions again, especially Marlene, Bob, and Danielle for contributing with the Q&A, with the help with the Q&A. But if there aren't any more questions, I don't see any reason to occupy any more time on your calendars. We're all busy. So we'll see the next half hour back to everybody else and let you get on with the rest of your day. Thank you all very much for joining us today.